And our third element, on next Thursday, and the focus of our final day of the symposium, we're going to identify a few of the innovative strategies to advance existing efforts in the county. So for those of you who are joining in and may not know a lot about MMF, Montgomery moving forward on our focus on ECE and children ages 0 to 5 was made even more critical as a result of COVID-19. The pandemic made it even clearer that early care and education is really an equity, class, and social justice issue. It's an economic issue, and it's an issue that touches every sector and virtually every person in our community. And it's an issue that belongs to each of us. MMF is a collective impact initiative. We started this initiative about 7 years ago, and it really was an effort not to create a group with an agenda, but to create a group that collected the community to identify what the concerns and needs of our community needed to be addressed, and to take a collective group to begin to address that. And so our leadership group is cross-sector, and we work in partnership with various advisory groups that reflect cross-sector commitment to ECE, including nonprofit Montgomery, which serves as our backbone organization and supports MMF, as we're not an organization necessarily unto ourselves. MMF's work on early care and education began 4 years ago as a workforce development issue. Our call to action aims to create a coordinated, comprehensive early care and education system that will support two critical goals: attracting and retaining talented workforce of today by supporting families with young children, and ensuring the skilled workforce of tomorrow by addressing the growing opportunity gap. To find out more about MMF and the symposium, check out the symposium landing page. And now I'll introduce Tricia, who you've all heard from already. Tricia Swanson is a member of MMF's leadership group and currently serves as Vice President of Government Relations at Montgomery County Chamber of Commerce. In this role, Tricia advocates at the local and state level for additional investments in economic development, transportation, and infrastructure and workforce development. And with that, I'll turn it over to Tricia.
Thank you, Mike. I have the wonderful honor of thanking our sponsors for the 3-week kind of symposium that we have. Montgomery County Department of Health and Human Services, Kaiser Permanente, Montgomery County Public Schools, Asbury, Montgomery College, Early Care Education Funders Collaborative, Community Action Agency, Per Conti, Montgomery County Economic Development Corporation, the universities at Shady Grove, Comcast, Greater Washington Community Foundation, Bob and Linda Youngtob, and David Andreas from UBS. So a virtual round of applause for all of our incredible sponsors for making today and last week and next week all possible for us to have these imperative conversations. ECE is an economic imperative, especially now more than ever. Now more than ever, it's really touching the workforce in our county and in our region. And it's an issue that requires a cross-sector collaboration and partnership. You heard Mike talk about the theme today. There's no I in ECE, and this theme really underscores the focus on partnerships during today's conversation. We're going to have an incredible few panelists that kind of speak more to the collaboration throughout the afternoon today. And as you engage with us today, we hope you'll leave with an increased understanding of why ECE is smart business, as well as the importance of cross-sector collaboration in advancing systems change in ECE. So to that end, we're asking you to make a pledge to share both the English and Spanish ECE toolkit for employers among your networks, and join MMF in advocating for increased investments in the ECE sector. And the majority of women and women of color educators who sustain this industry. Pledge your support by clicking on the link you will see in the chat, or by visiting the symposium landing page to learn more, to show your support, and to get in touch with MMF. The symposium landing page will also be updated after each of the 3 symposium events. To find out more about MMF or our work on ECE, pledge your support, and view recordings of the symposium, and also ways to get in touch with us and the event speakers. So MMF is fortunate that over the years of working on this issue, we've been able to successfully increase awareness among the business community about ECE as a business issue and engage their necessary partnership in advancing ECE priorities in the county. And I get to introduce the ECE Toolkit for Employers video. During the 2019 MMF Symposium, we secured support for creating a virtual resource that for employers to support their ECE needs. And it's an incredible resource. We spent much of the last year really making sure that it was a resource that speaks directly to employers in our county and in the region. And 1 year later, we're thrilled to share that not only is the website live, but it's also bilingual and available in Spanish. And thank you to all of those who have made that video possible. And that's the Maryland State Department of Education, Division of Early Childhood Services, the Montgomery County Department of Health and Human Services, Montgomery County Economic Development Corporation, Kaiser Permanente, Asbury Communities, and Anise Cody and Peter Braverman. And then we also have to thank the 5 sponsors that made our translated version in Spanish, and that's Pierre Conti, the universities at Shady Grove, Washington Area Women's Foundation, the Early Care and Education Funders Collaborative, Kaiser Permanente, and Bill and Linda Jungatab. And so thank you all so much. This was such an incredible resource, and it's ever evolving with more and more information. So we hope you will take a look. And while this website was valuable before COVID, it's now more than ever relevant and needed. And as many employers are now necessarily getting involved in the childcare considerations of their employees. We hope to be able to garner support to build upon the web-based tool in our new reality. So again, you'll see a link in the chat with the website, but also it's on the Symposium landing page. And I think we'll go ahead and play the video now.
Montgomery Moving Forward is thrilled to be a part of a community-wide initiative towards a system of early care and education in Montgomery County. We have been so lucky to have many community partners working with us in enhancing the system, including those from the government, nonprofit world, the business community, education, academia, philanthropy, and of course, so many wonderful community leaders. One of the resources that has been developed as a result of this working together is our Early Care and Education Employer Toolkit.
As a grandfather and a father of graduates from this great Montgomery County public school system, it was with real concern when I found out that over half of those entering kindergarten are not kindergarten ready. So what do we do as business leaders? What do we do as civic leaders? How do we address this big challenge? And through the efforts of Montgomery Moving Forward, I've been very pleased to have been associated with early care and education.
In the past, we have found that one of the key barriers to recruiting and retaining great talent is the perceived lack of availability of resources around early care and education.
And what's on the mind of these employees? Access to and flexibility around early care and education. This website is an incredible portal for you to use both as an employer and as an employee. For employers, we have 5 easy things that you can do right now to support your employees in ECE efforts. Everything from posters in the workplace to just having a conversation with your employees about what their needs are. We also have case studies all over the website, whether you're a company of 2 to 3 people or you have more than 500 employees. We have a vast number of solutions for you to support your employees.
We recognize the importance of amplifying the conversation about early childhood education. We recognize that one of our most tremendous assets is the quality of our workforce. And so we see early investments in early childhood education as a way to get to that effort. We really applaud the efforts to pull together a rich toolkit to provide to small businesses especially who may have an HR department of one and really are not equipped to provide the information that their employees really need. The resources are extremely rich and will allow them to make decisions and figure out opportunities.
Holy Cross Health is not your typical employer. We don't work on a 9-to-5 basis. And so when we started to think about how to support our colleagues, particularly around their ECE needs, it became a little bit daunting. That said, rather than getting overwhelmed by the idea of trying to support our colleagues in everything that they could potentially need, we decided to take it incrementally and start moving forward. And the toolkit really is that call to action for employers and parents in the county to keep this at the top of mind.
As a parent, as an employer, as someone who's engaged in the community, I can tell you that the most important thing, the thing that I think about most often is what can we do to help make sure the next generation have an opportunity to grow into the next generation of talent in this community. This is important because it impacts employers today, people who are in the workforce, who have young children at home who they're concerned about. And strategically, it's really important as a way of differentiating us and setting us up for continued success into the future.
Just sharing this resource with employees is a great benefit that employers can provide.
For our employees, we have an entire section of the website dedicated to supports that you can access, whether it's in the federal space for tax credits or statewide incentives.
The better educated parents are about the options for their children, the better able they'll be to commit to their work and also find that balance between educating and caring for their children and putting their best effort in their, selected careers and professions.
Thank you to all of you for your interest in early care and education here in Montgomery County. As we move forward towards the building of this enhanced system of early care and education for our county's littlest residents and their families, we would love you to join with us. There are many opportunities, no matter where you may live, where you may work, where you may play, to join us in this initiative. So come on board to our efforts and those of all of our partners. We'd love to have you with us.
Mike, I think we kick it over to you.
All right. Well, thank you, Tricia. And special thanks to our team at Montgomery College for putting this great video together, as well as all the participants and funders of the Toolkit project. We now turn to our first panel this afternoon, the business case for ECE, and all the panelists who are on the panel today represent businesses or business perspective for organizations within our community. First up is Marilyn Balcom. Marilyn is president and CEO of the Gaithersburg-Germantown Chamber of Commerce. She's actively involved in land use planning, transportation, and economic development, and her primary focus is bringing jobs to the up-county area of Montgomery County. Our second panelist this afternoon is Kevin Beverly, who is an economic development advocate. Kevin is the former president and CEO of Social and Scientific Systems, Inc. in Silver Spring, and executive officer of DLH Corporation. Kevin currently serves as vice chair on the executive committee of the board of advisors for the universities at Shady Grove, and he chairs the board of college tracks, as well as serving as advisor to the Children's Opportunity Fund in Montgomery County. And then our third panelist this afternoon is Bob Buchanan. And Bob is principal of Buchanan Partners, a full service real estate development company. He is a third generation builder developer involved in office, retail, industrial, residential, and large mixed use planning communities. Bob is also president of the 2030 Group, an association of Washington metropolitan area business leaders focused on regional long-term decision-making and solutions. And our facilitator this afternoon for this first panel is Michelle Green. And Michelle is executive director of the Montgomery Child Care Association. She's developed her understanding of the importance of early care and education and her passion for making a difference for young children during her tenure as the COO for 0 to 3 National Center for Infants, Toddlers, and Families, a national nonprofit dedicated to the health and development of children and families. And with that, I will turn over to Michelle for our first panel.
Okay, thank you, Mike. Thanks for the introduction, and thank you all for the opportunity to be here to talk about the business case for early care and education. And I thought we'd get the conversation going by first having a little context about what exactly is a business case anyway. Generally they're done, and they're done by all types of organizations. And they're done to evaluate products or services and establish what is the market need and evaluate the strength of a product and service and identify opportunities and challenges within the context of a business model. And so as we think about business cases, we can also sort of distill it down to sort of three easy questions. One is, so what? Right? So what? What about that product or that service? And who cares? Why is it important? And the third piece that we can distill business cases down into is saying, what's in it for me? So I'd like to start our conversation here with Marilyn. If you could just kind of talk a little bit about the so what of early care and education. What does it mean to your members and business leaders in our community? Why is it so important, particularly in the context of today's pandemic?
Sure. Thank you. I'm glad to be here, and this is a great panel. As you all know, we started this conversation about the importance of having a comprehensive system for early care and education long before the pandemic hit. And it's just that it's become even more salient during this crisis. And the so what is critical. This has been an insane time for the business community. There's no industry, no business that hasn't been impacted, regardless of size, location, industry. Everyone's had to pivot. And that includes interacting with the workforce. The workforce is front and center with this. Before the pandemic hit, among the top issues that employers had to deal with is the attraction and retention of employees. And that hasn't changed. Of course, businesses have had to deal with, we've had significant layoffs, we've had reduction in work hours, but we've also had to retain, a lot of businesses have had to retain employees, and that has to do with, work-life balance. And so that's the what of why businesses are, why they care about early care and education, why they're investing in early care and education, and why businesses have to make sure that, especially now, I mean, even before the pandemic, we just had to deal with work-life balance between the office and home. Now work-life balance is actually in your house. So people who are working at home and having children at home know that that doesn't negate the need for a comprehensive early care and education. So I think that the business community understands that not only for the workforce of today, they have to make sure that their employees feel that they can have this work-life balance, but also for the for the workforce of tomorrow. Early care and education is critical for businesses. We need to make sure that we have a pipeline of knowledgeable, educated workers 18 years from now, 16 years from now, 12 years from now. So I think it's a clear, for many businesses, it's a clear business case for why we're doing this. And I could talk all day about the issue, but I know we have two other people to weigh in. So thank you.
Well, yeah, so great. Thanks very much for that. And so Marilyn's helped us a little bit understand why it's so important. And I'm sure productivity of the workforce can't be all that it's meant to be if you're worried about whether your child is safe and well cared for. And so the importance of high quality childcare and services are so critical in order to enhance worker productivity. But I also, so if we get back to the question of we've got so what, now let's think about who cares. And we know that our business leaders care. And so Kevin, I thought I'd turn to you as a business leader who's interested in helping to advance policy. Why is getting involved in policy related to early care and education so important for our community leaders?
Good afternoon, everyone. Part of what I think the discussion today we ought to keep in the back of our mind is how we build communities and what's important to that. And economic development, and I'll use the word businesses and employers interchangeably because those businesses that we talk about oftentimes are also nonprofit organizations. And today, with the escalating needs of children, families, and communities, and the diminishing resources to meet those needs, it's those powerful coalitions between business leaders and the business community and employers, along with nonprofit organizations and government, that form that collaboration to help meet those needs, change lives, and help us build healthy communities. Most communities they're measured by that quality of life. And that quality of life generally depends on a vibrant economic development environment, and which is why the business community is very interested in it. We need to be able to attract employers to our region and into Montgomery County specifically. And we need to spend time making sure that when they come and see what we're doing here, that a workforce that is right now gonna be made up of millennials. This is a group who's coming forward, are gonna begin to have children, and they're gonna be looking for experiences in those communities. And we wanna be in a position where they look at Montgomery County as that place that's being progressive about how we think about employment, how we think about work-life balance, and how we engage not only in the issues of social justice around this, because what happens in a community with, especially Montgomery County, I've said over time, it's a tale of two cities. We have to be responsible in how we actually build out these businesses, and we have to be responsible in terms of how government responds to it.
Great, that's an excellent point. And now if we move on to the third question that is in our business case model and ask ourselves sort of, what's in it for me? So Bob, as a leader in the region-wide area of the greater Montgomery, Virginia, DC area, as we look for solutions, what's in it for regional partners as it relates to early care and education, and why should they be so involved in this issue?
Good afternoon, and thank you. I'm hoping that you can hear me because my laptop seems to be on its last legs, and I've got a combo of telephone and the Zoom. The issue I would raise is the need for our region to regain a part of the workforce that we've been losing, and that's the 25 to 44-year-old. And those young families or young workers that do have young families definitely need ECE. And the more that we can be proactive as a region, and especially as a county, the better everybody sees that we are fulfilling our greatest asset, which is the ability to have the highest trained and skilled workforce among all the metropolitan areas in the country. If we don't focus on this now and we're not proactive, we'll just be seen as overcome by all the pandemic issues that have been so well expressed by Kevin and Marilyn. My issue is workforce development now is probably the single most important thing in our regional economy. And the more we are proactively fixing it and seeking to remedy it, the better off we'll be. So I appreciate this effort. Montgomery Moving Forward has been a leader in Montgomery County, bringing coalitions like this together, and this topic couldn't be more timely. Thank you.
Thank you, Bob. And so, part of every good business case is also talking about the funds, right? The sources and the use of the resources, the money. So Marilyn, sort of back to you in terms of how do business partners and your members think about what their financial investment, or they're willing to actually put dollars on the table as it relates to supporting an early care and education effort?
Sure. So one of the things that we talked about when we developed the toolkit is that there are so many different ways an employer can help their employees. They can, as little as helping them to find daycare out in the community, to having a daycare facility in their actual place of work. So there's a continuum of opportunities for employers, and employers can make the investment based on what their resources are. So something as small as providing flex time, flex space, which we're very much in a great social experiment right now with flex time and flex space, to sharing information about tax credits. There are federal tax credits available to employees. They may not know about that. That costs zero for an employer, but it could be great savings for employees. So there's a menu of options for employers. And I think that depending on resources, many large employers are investing quite a bit in helping their employees. But we don't want to scare off employers by putting a huge price tag on. What we're really trying to convey to everyone is that every employer can help with this dilemma, regardless of their level of investment.
That's a great answer. There's small steps that everyone can take to help move this agenda forward. But I'd also, like to go back to Kevin, if I could, in terms of this issue of money. Funding policy also is often driven by the availability and the support of funding. So you talked a little bit about Montgomery County being a tale of two cities. How are we going to find the resources and the funding that's really required to move those two cities closer to one another from a funding and a policy perspective? I think you need to unmute.
Thank you for the question. The issues around how businesses get engaged in this early on, which I think has been one of the highlights of the Montgomery Moving Forward organization, is to bring the businesses in early to help them understand where the resources need to come from and understand how the tax base actually supports this, along with philanthropy, and which I think will be a big player. But I also believe that the business community, if brought to the table early enough, get an opportunity to participate at that policy level, and then can understand, what these, as Marilyn talked about, what these issues are before we see them, in some legislative document that says we're now accountable for something. So the dollars will come from growth. That's the one thing that we can control. We can set policies in place that allow businesses to have a little more flexibility, to reduce regulation around things that actually don't make sense anymore. And I think that happens by working with both the county legislature as well as our state legislatures to looking at policies that are impeding the flow of dollars throughout the state and the county.
Great, thank you, Kevin. And Bob, back to you. You talked about a skilled workforce really being your #1 priority agenda item, and professional development and fair and appropriate wages for skilled workers. All of those things also, they cost money. So can you talk a little bit about how those issues fit into the business case for early care and education?
It looks like Bob can't hear us.
Yeah, so Marilyn, why don't you take it out?
Okay, so I think one of the issues that answers your question but tags along with something that I should have mentioned is the competitive advantage of employers providing early care and education support for their employees. So just as we've evolved from, we now have Monday through Friday, 9 to 5. Well, we have a 40-hour work week. We have legislated sick leave. The policies will evolve in terms of what kind of support systems are there for early care and education. But for employers who do provide significant investment in early care and education, they will have an advantage when it comes to attraction and retention of employees. And so I think that the evolution, we always, from a business perspective, we look at it as is it a carrot or a stick? Are you offering an incentive or a mandate? Of course, from the business community, we like to see incentives. I think Kevin alluded to what policies could the state and local governments have for incentivizing this early care and education. But I think that what will happen is that significant investment will evolve because those are the companies that are going to get the best and brightest employees. Bob did allude to our workforce. The bulk of the workforce are working parents, and they're going to need this resource. And so I think that the evolution will be for more and more companies to provide more and more supports. Kevin, I don't know if you agree with that.
Yeah, no, I would, and I would add to that continuum of we're dealing with two things simultaneously, right? We're from the business and employer perspective, we have needs now, and we have to respond to those needs now. But we also recognize the systemic problem that happens if we don't build toward that, which is the whole early childcare and education issue. Is we need to start that focus on that set of policies that put our children first now, while we spend time at the upper end trying to make sure that the pathways that when they start closer to that employment age, that they have pathways to get into that allow them to feed into the companies that we have here in the region. And again, more specifically in Montgomery County. So the relationships that we build in workforce between this particular part of our workforce, this early childcare, where we're worrying about what they're doing, but we're also focused on their parents and their abilities to actually manage that activity at a reasonable cost. And then getting those kids to that point where we're introducing them into the workforce, and they're aligned with the jobs that are necessary in that particular economy or environment.
Yeah, I think that's a great point. I think it's also, I currently am the executive director of a nonprofit childcare organization who provides childcare services, and we're business leaders too. We're running businesses, family childcare, childcare centers, and in this current environment with reduced ratios and additional PPE and cleaning, our jobs of providing high quality, safe, and affordable childcare have become incredibly difficult. Our organization and many other childcare providers that I am in contact with regularly, we're all losing buckets of money. And that model isn't sustainable over the long term. And so, one of the things that I think is really important as we're talking about the business case for our early care and education is being mindful, right? Is that it's our workforce, it's our employer base, but it's also the providers of the service. And they have to be able to be sustainable in order for the system to not collapse. And I think that is a really important part of this conversation as we continue to think about policy, think about funding, think about how we advance all of this work on behalf of our children and families. This point,
if I could just add one point because what you said something is very important. I alluded to it earlier on regarding that when I speak about business community, we really are talking about employers, and there are many, like you said, in your part of the business that are in that nonprofit area that are also businesses who are also in this struggle with us as well. But that's where the innovation comes from. I think we know when we see things happen like the learning hubs that happen here in Montgomery County, where we saw a great example of business, government, and philanthropy come together and create something I thought was very special. And I'll shout out to a couple of folks at the Community Foundation who actually helped spearhead and bring that on, to bring funders to the table to help work with businesses that We're dealing with space in the public schools that allowed us to get programs to children that are part of that second city that we keep talking about.
Yeah, that whole Children's Opportunity Fund and the Black and Brown Coalition have done an amazing job of, along with Montgomery County Council and Government, HHS, getting funds available and getting programs up, working with private child care providers to help support these kids. And we're proud to be a part of that work, as I know many of my colleagues are. And it is, you know, this is a great model of how our entire community can come together to solve a really difficult problem in the middle of a crisis. And people have stepped up in some really amazing and interesting ways that should make us all feel good about the future of advancing the business case for early care and education.
Yeah, no,
So I would just at this point ask if there are any community questions, because I think we're pretty close to our time on this segment.
Hi, Michelle. We've got a couple questions that have come through the Q&A and the chat. I'll group these two together first. So there are many women, many parents and women in particular who are leaving the workforce during this pandemic time. Could the panelists speak to ideas that would help to bring parents and especially women back into the workforce and strategies that would support that? And a related question is, you know, post-COVID, what might employers and the business community at large be able to do to continue to maintain awareness and increase support for parents with young children to bring them into the workforce at greater numbers?
Let me jump in on the second part of your question, Farah. The issue of, as I mentioned, we're in this great experiment right now about flex time and flex space. There were a lot of employers out there who were very reluctant to look at flex space and allowing people to work from home and whether it was effective or not. Well, we've proven that it is effective. People all over the world are working at home and working at home effectively. So I see that flex space is here to stay. We're not all going to be working from home for the rest of our lives, but it will become an important part of work-life balance. So I think that's going to happen. Similarly with flex time, work doesn't have to get done between Monday through Friday, 9 to 5. So I think those two things we'll see. I think the issue of women leaving the workforce is distressing, and I think that it shows to me that talking about the business case, we cannot afford to lose a significant chunk of workers. We already have a shortage of workers already. And once we get back on our feet, we have to solve this issue. And we can't afford to have a significant portion leave the workplace. I'm hoping that it will naturally come back. Kevin?
Yeah, I think I'd add on to the issue of women leaving the workforce. You know, we did a survey of our parents back in early June when the pandemic was, you know, we were about 3.5 months into it. But we asked people, you know, when would you be comfortable coming back to childcare, right? And 20% of the respondents said never. And 20% of the respondents said when there's a vaccine. And then the balance were sort of, well, it depends. It depends on safety issues. It depends on how there would be availability of PPE, a whole very a set of issues related to security and safety of their children. And so I think the issue of leaving the workforce is actually a really complicated one. And it's been further complicated by virtual learning. And we were just talking a little bit about a minute ago about the virtual hubs that we're trying to put in place to help parents be able to manage their schedules and go back to work while their children can still learn. And so, you know, part of it is the sustainability of the childcare model, the sustainability of what's good and right for our children from an education perspective, and whether and when families are going to feel comfortable going back into the workplace is all really dependent on a public health crisis that we're facing. And we have to remember that all of these issues sort of work together to impact early care and education and our ability to advance what we're doing here.
I would add that part of what we're, as Marilyn said earlier, businesses respond to incentives. And I think some of the things that you've just mentioned, Michelle, around how we think more around these bubbles that we create that allow people to be a little more flexible. But governments, again, an opportunity for government and employers to work on this is to really create some incentives for businesses to deal with this. Allowing business, and businesses have to own a bit of this. They really do. They really have to think about if that employee who is now telling you that I may not be back in the workforce, you're making a decision right there about whether or not what the value of that employee is. And I think you really do have to ask businesses to make some hard decisions about what their futures are and where their futures lie. And if they're willing to walk away from employees because they've got family obligations, I'm not sure those businesses are going to be around, because that workforce is going to need that labor. We're, as Marilyn said, we're already short. And to lose talent out of our workforce, regardless of diversity, whether it's Black, white, brown, female, or male, if you're not providing the opportunity as a business to take advantage of the fact that you got a strong employment base and you're allowing it to walk out the door, it's just not good business.
Yeah, and so I think I'd like to wrap this section up now and thank Marilyn and Kevin and Bob very much for your keen insights and your participation as it relates to, I think we've established there is a business case for early care and education, and what we need to do is continue to see, government, the private sector, and businesses and everybody continue to work together and make sure that we're all trying to advance this issue on behalf of the children, the families, and the important community here that we have in Montgomery County. So thank you all for that conversation.
Thank you. You're welcome.
Okay, and so I think that I'm going to invite people to participate further afterwards. We are going to have a separate chat room that you can come and chit chat with people about this issue if you want to continue the conversation. And you can also learn more on the event landing page. And with that, I think I'm giving it over to Tricia.
You are, yes. Thank you, Michelle. Thank you for doing such a great job moderating. You bring such an incredible background and knowledge of ECE, but I think also looking at childcare providers as businesses is so incredibly important and imperative part of the conversation too. So really appreciate your moderating the panel. And again, I want to thank Marilyn, Kevin, and Bob for not only their participation in MMF and making sure that there's a voice of business in these meetings with MMF, but also taking what we discuss at MMF and bringing it back to the business community so that the business community at large can really understand the case that we're making for ECE. I now am really excited to introduce today's ECE Interlude. The ECE Interlude is intended to offer us all an opportunity to learn about early care and education in an interactive way, while also demonstrating the value of fundamental ECE principles throughout the lives of young learners. So please join me in welcoming Rosalba Bonilla Acosta, Director of Centro NIA, and Amanda Puerto Thorne, Director of Teaching and Learning at the Kid Museum, who will lead us in an activity on the topic of team building and collaboration. Rosalba oversees Centro NIA's growing operations in Maryland, stewarding the organization's high-quality, comprehensive early childhood education services to respond to the needs of low-income families in Montgomery and Prince George's counties. And Amanda is the Director of Teaching and Learning at the Kid Museum, where she oversees content and pedagogy across the museum's education programs. She has a special expertise in technology integration for early learners, as well as teaching robotics and coding. So I will turn it over to these two incredible leaders in our community.
Good afternoon, everyone. Did you know that the highest rate of return in early childhood development comes from investing as early as possible from birth through age 5? I am very happy to be here and thank you for being here with us to have fun. We're gonna make sure you guys have fun with this 10 minutes. Thank you.
Hi, everyone. Thank you so much for having us here today. We're really excited to walk through this activity with you. Not sure, I think our slides are not up. So if we can get those up, that's fine. Otherwise we can, oh, there they come. Okay. So we're gonna start with a challenge for everybody. And it would be great if you could participate in the chat through this challenge. So we're gonna ask you to, if you're able, to get up from where you are and collect 3 objects from around your home. If you're not able to do that right now, you can just go through kind of a mental walk through your home and think about 3 objects that you might collect. So these should be objects that can be anything you can pick up and hold. We're not gonna use our laptops, tablets, or phones for this exercise. And once you have your 3 objects, either in your hand or in your mind, you can go ahead and type them into the chat. So right now we're doing an exercise that we might do in an early childhood setting. And you guys are gonna experience that firsthand. Awesome, I see some great things coming into the chat. I'll give people another minute or so to collect their items, either in hand or just thinking about them. Thank you all so much for your participation. Oh, I somebody put a dog. That's a good one. Awesome. All right. So as you type your own in, do take a look at the chat and think about some of the things that other people have put in, because that'll be helpful to you in a minute. So we can go ahead, as people are just finishing up typing these in, you can go ahead to the next slide and I'll pass it over to Rosalba.
So how we're going to use these items, or how we're going to share these items. So imagine you are in a rowboat in the middle of a large lake. You have lost your oars. Which of the 3 objects you will use to help you get back to shore? You can use a combination of objects or someone else's objects for a better solution. So this is, as you can see, an exercise about sharing other people's objects, and you can use yours or in resolving a complicated problem. We have so many good objects on the chat that we can use.
So you can go ahead and look through that chat, think about which object of yours would you choose, and if you would combine it with some of the other objects that you see, and you can go ahead and type your response to that question in the chat as well.
So you're in the middle of the lake and you have lost your oars. What will you use?
We got a book to distract you. See some really great answers coming in.
Thank you, everyone, for adding to the chat.
Pepper
spoon to roll with.
These are great.
Someone else boat, okay.
This is so awesome.
Little bottle, yeah.
You can see a lot of creative ideas here, as well as a lot of creative combinations of different people's ideas here. Somebody would write a help sign with their pen and paper. I see a lot of using books for oars. These are really creative ideas. Don't forget to share, that is true.
Right. The help sign is amazing.
So like we said, this is an exercise that we might use in an early childhood classroom or other early childhood setting. And you can see here how kids would get the idea that it's better probably to use a combination of different people's ideas and how to work together, as opposed to just using the 3 objects that you chose, unless you happened to choose an oar. Rosalba, should we move on to the next slide?
Yes.
All right, so far, if you can change slides for us. So this image here that you see is actually from Kid Museum, where I come from, and it is our sort of approach to teaching and learning at Kid Museum. So we call it Mind of a Maker, and it's a set of skills and practices that we try to get kids to engage in every time they come for maker programming at Kid Museum. That's what we do, STEM and maker programming. So we call this Mind of a Maker. But when Rosalba and I were going over this activity, we thought that this graphic really captures well what are the skills, not the academic skills necessarily, but what are the soft skills that we're really trying to get kids to engage in early childhood. So you can take a look at these skills here: invention, exploration, reflection, agency, perseverance, teamwork, skill building, and empathy. And I want you to think about, in this exercise that you just did, either yourself or you can think about how kids might engage with this exercise. Can you think about which of these skills did you have to use in this Choose 3 challenge? You can go ahead and type your responses into the chat.
And this is assuming we all survive.
We made it back to shore from the boat.
Yeah, we'll make it back to, yes.
Definitely see a lot of plugs for invention here.
Mm-hmm.
Teamwork, of course. Exploration is an important one as well. Empathy, agency. We've pretty much covered them all, I would say, except for maybe skill building, which, you know, this activity wasn't really designed to, oh, we got a skill building, yay. So as you can see, activities like this, you know, not only are they getting kids thinking creatively, thinking about problem solving, but they're getting kids to work together. They're getting kids to feel, you know, feel empathy for one another and to take other people's perspectives. And these skills are really important in early childhood. And as you all know, as you know, adults and professionals, these skills carry through for a lifetime. So activities like this are really helpful for getting kids to start working with these skills and ideas. And they're the basis of what we're trying to do in early childhood education. So Rosalba, I'll pass it over to you.
That was great, thank you. So now, now we're gonna watch a video, and feel free to also use the chat to share your thoughts and idea about the video. And the question that we want you to walk out with is, how are we working together to improve early care and education crisis?
The problem appears to be unsolvable. Maybe we could run some computer simulations.
There are too many variables. It would take forever.
We've got to be missing something. Let's start again. The movie is playing here at 7:20, here at 7:40, here at 8:10, and here at 8:45.
All right, these theaters have to be eliminated.
Why? They're state-of-the-art, digital projection, 20-channel surround sound.
Yes, but they have no icy machines. Despite my aggressive letter writing campaign, I might add.
What about the multiplex here? The seats are terrific.
They have Twizzlers instead of red vines. No amount of lumbar support can compensate for that.
Well, it's going to take at least an hour to eat, and I don't see a Sheldon-approved restaurant proximate to a Sheldon-approved theater.
We could eat after the movie.
Unacceptable. The delay would result in tomorrow morning's bowel movement occurring at work.
Hang on. There's a 7-Eleven here. We smuggle Slurpees, which are essentially ices, in under our coats after having a pleasant meal either here, or here.
Wow. I don't see how we missed that. Excuse me, in what universe are Slurpees ices?
That's how we missed it.
Sheldon, would you be prepared on a non-presidential basis to create an emergency ad hoc Slurpee icy equivalency?
Oh, Leonard, you know I can't do that.
Okay, I guess we only have one option.
Yep, I don't see any way around it.
Bye, Sheldon.
See ya.
They'll do it.
They're right, it was the only option.
Thank you everyone for your participation. I hope you enjoyed the video and think about the question, how are we working together to improve early care and education crisis? Thank you.
Everybody.
Great. Thank you, Rosalba and Amanda. I get to points like this and I'm always reminded why it's really, really good. I never got into education, but I'm really glad that people with the passion and the background that you both have done so. And thank you so much for identifying demonstrating how team building and partnerships are such fundamental skills, and that they're really, those are the things that we're doing from 0 to 5, and they set the foundation for how we grow through the rest of our lives. And so, thank you again, and please visit again the Symposium landing page to learn more about Rosalba and Amanda and the programs that they both run. Now it's time to introduce our next panel, and that is Making It Happen with Cross-Sector Partnerships, where we're going to hear from public and private sector partners from the government, ECE, business, and philanthropy sectors about working together towards ECE systems changes. Our panelists include, first, Joanne Barnes. Joanne is Chief of Children, Youth, and Family Services for Montgomery County, Department of Health and Human Services. Joanne has served as Montgomery County residents through HHS for over 30 years. Joanne's work in HHS and children, youth, and families in particular is very dynamic, responding to many issues that affect children from birth to 24 and meeting the basic needs of low-income families. Christina Push is the Executive Director of the Maryland Child Care Association. Christina has over 15 years of experience working in nonprofit early childhood and child care programs. She serves as the co-chair of the Office of Child Care Advisory Council, serves as a governor appointed member of the State of Maryland Early Childhood Advisory Council, and as a commissioner to the Lead, Poison, and Prevention Commission. And she's an active Maryland Family Engagement Coalition member. And William Weishman, who is Vice President and Regional Counsel of the Kaiser Foundation Hospitals and Health Plan. Bill serves as Vice President and Regional Counsel of the Kaiser Foundation Health Plan of the Mid-Atlantic States, managing the delivery of legal and business services across Maryland, Virginia, and Washington, D.C. markets. And he has a passion for serving others and works closely with the Kaiser Permanente Community Health Program. And our facilitator for this panel is Anna Hargrave, who is the Executive Director of the Greater Washington Community Foundation of Montgomery County. Anna was drawn to the foundation's mission to build thriving communities by providing leadership on pressing issues, inspiring local giving, promoting civic engagement, and guiding strategic philanthropy. Anna also oversees the Community Foundation's strategic grant-making initiatives focused in Montgomery County. And with that, I will turn it over to Anna to facilitate the next panel. Take it away.
Thank you, Mike. So first we want to start with Joanne. Can you share some examples of high impact cross-sector partnerships? And I think the group in particular wants to hear about efforts before, but also during the pandemic, and how lessons learned from that can lay the foundation for our sustained recovery.
Okay, good afternoon. Thank you. I'm still trying to get the hang of turning my mic on and off. But I'm delighted to be with you this afternoon. I do want to talk a little bit about some of the cross-sector partnerships that we've been involved in the early care and education domain. There's a lot of collaboration that has gone on between various branches of public and private sectors. When we started our early care and education initiative in March of 2019, one of the things that we had to do first is establish some strong collaborations within county government. So I'm going to talk a little bit about the importance of doing that work, and then I'll talk about some of the cross-sector partnerships that we did. The first several weeks of our initiative was getting the right agencies around the table and recognize the points where all of our work intersected. That included not only the Department of Health and Human Services, but Montgomery County Public Schools, Montgomery College, WorkSource Montgomery, permitting services in the county, and as well as our Maryland State Department of Education's Regional Office of Child Care Licensing. So we were all critical partners in the public sector work that needed to share the investment in the accomplishments that we wanted to see happen in Montgomery County. And one of the biggest accomplishments I think that we've made over the last year or so is one of our partnerships with Montgomery County Public Schools, where we were able to invest in so far 2 early childhood centers in Montgomery County. And one of those centers that opened at the beginning of last school year, just before the pandemic, we opened a second early childhood center. MCPS opened that center at Emory Grove, and Department of Health and Human Services was able to open a family involvement center at the same location. Now, this was an effort where we looked at the needs of the community. We looked at what was available in the community as far as child care resources. And not only did we have pre-K seats opening up at Emory Grove, but we also had some seats opening up that worked with children and their families who were not engaged in preschool. So where a parent might have had one child going to the center for pre-K classes, they might have had a younger child that they could go to the family involvement center and learn some techniques and things like we just saw our child care providers enlist child care educators enlist with us over the interlude. They would be teaching parents at the Family Involvement Center different types of techniques to use with their younger children before they were enrolled in pre-K. And once they enroll in pre-K, they'd be able to advance to the early childhood center. So that's a collaboration that we were able to do as a result of our initiative, as a result of coming around the table, having conversations about what we were looking at in what particular geographical areas, and making sure we were doing the best to serve families in that neighborhood. When we look at other cross-sector collaborations, I'd like to point out another one that we did prior to the pandemic. In Montgomery County, we became active members of the Washington Area Women's Foundation Regional Early Care and Education Network. That's a network that focused on organizing and developing an implementation plan that would create an early care and education career pathway for early childhood staff in the DC region. It included membership from different counties in Maryland, from the District of Columbia, as well as Northern Virginia. We were working hard to look at what the competencies needed to be for an educator, and to make sure that we tied those competencies to both quality of care and compensation for our staff. Now you might say, why do I mention that? Because that work that we did over a 3-year period with a collaborative group that represented different sectors of early care and education, it included child care providers, child resource and referral centers, community college, nonprofits, and community and family child care centers. But the work that we did collaboratively, looking at what it takes to create standards for our early childhood educators, then helped to inform some of the work that we've done in our early care and education initiative just over the last year. When you look at the work that we've done with Montgomery College as part of the initiative, where we're working on improving career pathways and opportunities for funding professional development and helping childcare staff get their certification requirements, all of that work is based on the lessons that we learned from that collaboration that included not only public sector partners, but businesses and private sector providers as well. So we built on what came out of that first collaboration and used it to help strengthen the work that we're currently doing now as part of our initiative. The other thing that we've used some cross-sector collaborations to build, we're looking at opportunities to expand the availability of subsidized childcare in private and commercial space. In Montgomery County, we've had for a long time what we call a child care in public space program, where the county has subsidized space so that providers can provide adequate care in neighborhoods where there's a need. Need was determined at that time. But we want to see that program expand to the point where not only is the county providing the space through community centers and through MCPS, but also by partnering with the private sector, commercial landlords, and other private sector partners that have available space in areas where workers need childcare, that we might partner with them and provide additional subsidized childcare to support the workers and the families in those communities, and have those opportunities expanded for low-income families, and create jobs for childcare providers in areas where they is not adequately covered. Maybe I would call that our childcare deserts. Now, we recognize that a lot of the work that we've done is now being impacted by the pandemic, but I think that the foundation that we've built through both of these examples that I mentioned will continue as we move through the pandemic and see our childcare providers strengthen, see our children back in both in school and in childcare at the capacities that they were prior to the pandemic. We are looking at opportunities to work with private housing developments to see if we can create childcare space in new communities. We're also looking for opportunities to work on commercial space that's being currently open in the county. For example, we are working closely with Maryland National Capital Park and Planning in their new building in Wheaton to help them have the right provisions so that a childcare provider can go into their new space. That's just one example of what we want to see happen. But I think that there are many other examples that we can look at around the county, and our county Department of General Services has committed to help us look for opportunities that we might have further conversations. I want to turn a little bit and talk now about what we've done as part of the recovery to the pandemic. Some of the collaborations that we've put in place as a result of the pandemic. We have been involved with the Office of Emergency Management and Homeland Security in the distribution of PPE and cleaning supplies for child care providers. We've heard through our Resource and Referral Center that as child care centers opened up, even in the summer, for essential provision of care for essential employees, that personal protective equipment, PPE, was a significant obstacle for them. The availability of it, finding it, and being able to afford it. So we did participate in several distributions over the course of the summer in distribution of PPE. I think the last one that we had was at the end of July, but we've also now engaged in investing additional dollars into a partnership with purchasing cooperatives so that we can establish a pipeline for available supplies to child care providers. That's something that we're working on and hoping to launch in the next couple of weeks, but it is a continuation to the work that we were able to provide within county government for a short period of time. But now we're moving that into a cross-sector partnership with purchasing collaboratives, where we hope to create relationships between those collaboratives and child care providers, give them some support to get started with additional county funds to help build that relationship, and then hopefully have good relationships established with child care and with purchasing agents that can help not only with the costs, finding a good cost for PPE, but also availability. Because as things progress and we go into another phase of the pandemic, we're likely to see many of those supplies become scarce again. Lastly, I want to talk about the listening sessions that we held for through the Resource and Referral Center. We held a series of listening centers for providers, both family child care providers and center providers. We held them in English and in Spanish on, I believe on Mondays was the day that we held them. But we used those listening sessions to gain information from providers for the type of remedies that we wanted to put in place to support providers. We knew that within government, we couldn't come up with the best solution to what type of interventions to put in place. So we relied on our private sector partners to meet with us and give us feedback on what was happening in their businesses as a result of the pandemic. We thought we knew, but we didn't want to make decisions based on solely what we thought. We thought it was important to bring our providers to the table. And based on those conversations, we were able to implement several initiatives as part of the recovery. The first was the supplements that we paid to child care providers for essential child care, for school age and for early care and education. So what amounts were paid by the state, Montgomery County was able to supplement those amounts because, again, we knew the cost exceeded the amounts the state was paying. We also then implemented the early care and education 0 to 5 provider grants, where we paid out over $10 million to over 400 different providers in the county to help support losses from reopening, losses and to help reopen both. And then ultimately now we have piloted 2 programs for school age child care. All of this, again, because we were able to reach across the aisle to our private sector partners and find out what best met their needs. So those are the examples that I wanted to bring today, and certainly I'll be glad to answer any questions.
Thank you so much, Joanne. We're now going to switch over to Christina to talk to us a little bit about your role on MMF's Early Care and Education Advocacy Coalition, and to reflect a little bit about what does collaboration really look like.
Thanks, Anna, and thank you to Joanne for eloquently sharing the important work, partnerships, which entails lots of collaboration. And of course, for Montgomery County leading the way, we wish the state would invest as much as Montgomery County has in listening and providing additional funding. But the collaboration is basically it's the action of working with someone and to produce or create something. And so collaboration is also important because it's part of advocacy. And advocacy is a proactive stance taken by individuals or groups in response to a particular issue that's of a concern to them. And in early childhood education, the purpose of advocacy is to promote ideas and seek resolution that will affect children and families in positive ways. And I know that the coalition on the Montgomery Moving Forward Workforce Advocacy has been working very hard on those issues. And my role is equal to and just one of the more than 50 cross-sector leaders collaborating and advocating with MMF Workforce Advocacy Coalition to support the recovery and resilience of the ECE workforce, therefore leading to the recovery and resilience of economic health in our state. MMF has brought a robust cross-sector of individuals and organizations to the table to collaborate. The priorities together, this coalition has identified immediate priorities and long-term priorities. Together, the coalition has identified those, and such as issues around equity and wages and compensation, competencies and career pathways, and more urgent immediate needs such as funding related to the pandemic issues, including reduced capacities that Joanne just talked about to ensure childcare is viable post-pandemic, funding for childcare scholarships to increase, funding for full-day school-age care to support childcare providers and the children and families they rely on these programs, especially as many childcare providers are supporting school-age distance learning students full day, just as they stepped up and supported the essential personnel workforce all these months. We have written numerous letters that were constructed together and sent to state and federal leaders, including the Maryland State Department of Education leadership, the congressional representatives that represent us at the federal level, and Governor Hogan in his office. Montgomery Moving Forward has also recently increased their advocacy efforts by partnering with a state lobbyist to work in collaboration with the coalition and represent our issues at the state level and local level. The words cross-sector are really important. Montgomery Moving Forward Coalition strives to be inclusive of many perspectives, experts, and authentic voices necessary to collaborate and advocate effectively to impact positive change. We all understand the return of the childcare sector is necessary for the economic recovery of our nation, as well as ultimately building a robust and diverse, resilient ECE system, which will pave the way for long-term economic gains for our county and our region. MSCC aligns with the similar priorities of MMF Coalition and represents a diverse cross-sector of women, over 4,800 working in the field of early care and education, and it's representative of our country. Early care and education sector is mostly women, essential working in our field, undercompensated, primarily women of color, leading as early childhood educators, owners, operators, and primarily small businesses that have they provide a critical lifeline for employers and for the economy, and they help keep the Maryland workforce working. And the pandemic has really thrown us a curveball. We are all concerned about the future of childcare and the workforce. In the best of times, the U.S. economy and the childcare industry operates on razor slim margins. Children come and go, which means revenue is unstable. Childcare centers across the country and in our state, including big, small, nonprofit, for-profits, they're all teetering. Enrollment is decreased and it has stayed decreased since the spring and has never really fully recovered. Extra expenses, including PPE, deep cleaning, sanitation supplies, extra staffing to adhere to the very strict childcare specific CDC guidelines are piling up. Some estimates that we have read show 40% of the US childcare are closed. MSDE in Maryland conveys the data recently that 87% of Maryland childcare programs have reopened and 13% remain closed. But there is more to discuss behind those numbers. Many of those programs that are open have half the number of children they did in February or less. Some have wait lists depending on the age of the child and where they're located. And just because Maryland says 80% of childcare programs are open, it doesn't mean they have enough children to sustain or staff to sustain their business. A distinction to make is that the amount of slots available for families are also at risk. Family childcare providers pre-COVID accounted for over 41,000 slots, and center-based childcare accounted for over 187,000 slots. We don't know where we'll be in the future, but we do know post-COVID that we will need these businesses to be viable. Insufficient access and affordability issues are limiting productivity and having a negative impact on business growth in our state. COVID-19 has underscored the gaps that exist in Maryland's childcare ecosystem and shed a very bright light on this. There's over $2.41 billion in cost to employers in Maryland for insufficient and affordable childcare provisions for their workers, a $1.2 billion loss of economic activity to the state because of childcare constraints, and a $117 million loss in tax revenue given reduced salaries from parents who must watch children rather than work. Our lawmakers and economists are warning that many childcare providers might fail without some investments. So if that happens, parents will struggle to find slots before the pandemic. Will have an even harder time finding them when it's over. Childcare is a public good, but provided by a private industry with little investment. Collaboration and advocacy are important, and now more than ever, and they do make a difference. MSCC has partnered in many other ways and collaborated, including our work on the Kerwin Commission and passing amendments to make sure that our childcare programs can still be sustained with our 3- and 4-year-olds. We work every year to collaborate as co-sponsors with the Early Childhood Initiative of Evening in Annapolis. We work closely with Montgomery County on that, providing bus services to childcare programs and providers that would like to meet with their legislators and discuss these childcare issues and funding issues, business issues, because as Joanne mentioned, quite importantly, we are businesses and are economic drivers to our state. And we have many other initiatives, which you can see there is a slide that shares many of the other partnerships and collaborations that we do. And I want to make sure I leave time for William, our next panelist, but I am happy to go back to more of those partnerships and collaboration.
Thank you so much, Christina. And with that, we want to call on Bill to tell us a little bit about why early care and education is so important to Kaiser Permanente and how you approach partnerships.
Thank you, Anna. Can you hear me okay?
Yep, we can hear you, Bill.
Okay, great. Thank you. And thanks, Joanne and Christina. Really insightful information and great work within the community. As a healthcare organization, Kaiser Permanente has been delivering an integrated approach to healthcare for the better part of 75 years. And through those years, we've realized and appreciated just how important our environment is and the social impact of environmental determinants in our long-term health. We've learned that our experiences, like where we live, whether we have a roof over our heads, whether we have heat in the winter and some form of air conditioning in the summer, whether we have good food to eat that's nutritious and balanced, whether we have even things that we often take for granted, like transportation to get to and from work or to and from school or the doctor's office. All of those things are determinants of our overall health. And probably at the top of that list, I think it's safe to say that early childhood education is a health imperative. I think our panelists have done really an amazing job illustrating the business case and the economic case for her early childhood education. But there's a health imperative as well. We know that individuals with higher levels of education have a longer life expectancy. We know that infant mortality is much higher for babies born to women who haven't graduated high school. We know that, excuse me, children of adults who have not finished high school are much more likely to report being in poor health. And these are just some examples of how important it is to have appropriate early childhood development and education so that people can reach their full potential in other formative years through higher levels of learning. We believe at Kaiser Permanente that early childhood education is a must-have, not a nice-to-have. And so we also understand that it will take a village. It's also a social imperative. So we've learned the economic imperative, it creates jobs, high-paying jobs. It fulfills a workforce and helps retain strong employees. It creates, it fills a health gap by creating opportunities where people can thrive and seek and retain higher paying jobs. But none of this can be done by one organization. It cannot be done by one sector of the community. We've really got to partner and collaborate together. We look to Montgomery moving forward as an example of pulling a cross-section of the community together. We see representation from the government, from the school systems, from nonprofits, from health systems, and businesses alike. And it takes that kind of engagement to lead in this space. And so for Kaiser Permanente, we look for partners such as MMF to really lead and help us lead with them in this space. We're really proud of the work that MMF has done in the early education toolkit. We have played a role along with other MMF partners in helping develop that information. And I think if you leave with nothing else, as a business owner or as a member of the community, I really implore you to look at that material and really share it, use it at your own business, and try to cascade it. I think that's one way. It's a pretty straightforward way of really engaging in the community and partnering, just leveraging that kind of information and sharing it. Within it, you'll find really good information about how to find resources for daycare, how to find early education programs that your workforce can benefit from, how to take advantage of tax credits and so forth. So there's so much information that's worthwhile. At Kaiser Permanente, particularly in light of the pandemic, we've drawn principles from the toolkit and cascaded them to our own workforce. We've implemented things like an advice line where people can call and learn about resources in the community for daycare and other necessities. We've implemented grant programs to help alleviate some of the pressure on childcare. For some of our frontline healthcare workers, we've implemented some temporary housing opportunities so that they could be closer to work and avoid public transportation as we're trying to social distance. So there's lots of opportunity that we can use, starting with just leveraging the information that's already out there. I think we can also try to be generous with our own resources. And I know at Kaiser Permanente, we want to invest in programs like MMF. And I think that's important. And where we have the ability and the means to do it, I think we should step forward and do it. We can also lead by example. As individuals, we can lean in and we can be advocates and champions of this under-resourced area. And to me, it's so important that we invest in our children. And while I think we like to believe that we have a strong education system, if we forget about the people, even in the womb, from birth through pre-K, and we don't give them the opportunities and tools to to really thrive and be prepared to learn as they get into the more traditional levels of learning, K through 12 and hopefully beyond, I think we're doing our community, our businesses, and our families a disservice. And so at Kaiser, we've tried to partner with other like-minded organizations, certainly MMF. We've rolled out the Mid-Atlantic Community Network as a technological platform to link nonprofits together and provide an application for people to access those resources. We've been partners with the public school system through our Front Thriving Schools program, implementing programs like our HEAL program, which is a healthy eating and active lifestyle program that we impart onto students in the schools and the teachers alike. We bring in resiliency programs to teach coping skills. And we're hopeful that the students who learn these skills bring them back to their families and teach them to their younger siblings and their older siblings and parents alike. And we've partnered with the Beaumont Foundation nationally to implement a process by which cities across the country can adopt public policy, among which is early childhood education that will only lift up their communities. Baltimore just received a bronze medal recognition through the City Health program with the Beaumont Foundation. With that, I'd like to wrap it up. I would just, provide the parting encouragement to the businesses within our community to rally around this important issue and really take the reins and try to implement early childhood education and advocate for it. It's so important to the community and it's a win-win for businesses and public and private sector alike. So I want to thank everybody and thank MMF for this opportunity to share my thoughts.
Thank you so much, Bill. And also thank you, Christina and Joanne. I think the three of you and really everyone on the call today has really hammered home the fact that cross-sector collaborations, they're not a nice to have. They are absolutely essential to building the system that we need. And to do that, we need more foundations and businesses really diving in head and heart first, bringing not just financial resources, but approaching it the way you do. Bringing all of your expertise and insights so that way we can all tackle this problem together. So thank you. So again, in the chat, you should see a link. We're going to continue the conversation. So if there are any questions, you should please stay on and join us. And now I'll turn it back over to Tricia.
Thank you so much, Anna, for doing such a great job moderating. And again, thank you to Joanne, Christina, and Bill for that incredible overview of a lot of great information. I now have the distinct pleasure to introduce Crystal Townsend. She's going to close out our second day of the symposium. Crystal is the president and CEO of the Healthcare Initiative Foundation, which supports organizations that offer solutions to improve the capacity, ability, and deliver quality of health and wellness services for Montgomery County residents. Crystal, over to you.
Thank you, Tricia. And thank you to all the event MCs and to all of our panelists for your contributions today. And a heartfelt thank you to all of our sponsors who made today's symposium possible. Today's theme is there's no I in ECE, and what role do partnerships play? During our first day of the symposium, we heard from Dr. Ferguson about the case for investing in early care and education. And he reminded us that the lack of investment in early care and education for birth to age 5 results in wide and sustained academic, social, emotional, health, and economic achievement gaps for children that remains throughout their lives. We also learned that successful community interventions rely on partnerships at every level and in every sector. And truly to understand the investment in early care and education and investment in our human capital. COVID-19 pandemic has made it even clearer that early care and education is an equity, class, and social justice issue, an economic issue, an issue that touches every sector, and an issue that belongs to each of us and has impacted us all, whether you're a parent, grandparent, colleague, employer, provider, or leader. As we create a system, we cannot leave anyone behind. Gratuitously, the theme for today is there's no I in ECE. And we heard what roles businesses, employers, government, philanthropy, and healthcare, and the childcare sector play in partnership to offer a multifaceted strategy to address the disproportionate impact of COVID-19 on ECE. We heard examples of how this is best accomplished with the business sector focusing on supporting our families with flex time, flex space, serving as vital, important connectors to early care and connection, being advocates, and seeking opportunities to invest in effective collaborations such as the Equity and Education Learning Hubs. We also learned about fascinating cross-sectoral where government, philanthropy, and business and the healthcare field are finding alignment and developing strategies to meet common goals. And we're seeing such innovation and fabulous strategies that are really bolstering up our workforce, our ability to train for the future, investing and creatively in new initiatives that expand to combat childcare deserts, and collaborations in new ways with MCS and intergovernmental partnerships that create childcare center and family centers involvement. And I think really also demonstrating the importance of us all not working in silos. You know, as mentioned, individuals with higher levels of education have a longer life expectancy, regardless of race and ethnicity, and that early care and education is a must-have and not a necessity. While today's conversation showcases some key partnerships, there are still others to be brought to the table. The faith community, parents and caregivers, minority-led organizations, libraries, civic organization, recreation, nonprofits, media, etc. Our job in creating an integrated system for early care and education is to ensure that everyone sees that they are part of the system and solution. We also know that as we move forward and include additional partnerships, we will continue to collaborate with and build upon existing ECE systems that have been and remain essential to building a better ECE system, integrating with vital early intervention and home visiting programs such as Healthy Families Montgomery, Duty Center, Parent Encouragement Program, Early Head Start, Discovery Station will all be a part of this forthcoming work. Please join us for session 3 as we identify innovative strategies to advance existing efforts in Montgomery County. We also ask that you take this action today, as Tricia and Mike mentioned at the start of today's event. We hope that you'll be leaving us with an increased understanding and knowledge, but that you also make sure you make a pledge to share both in English and Spanish the ECE toolkit for employers among your networks, and join MMF in advocating for increased investment in the ECE sector and the majority of women of color educators who sustain this industry. You can pledge your support by clicking on the link you'll see in the chat and by visiting the Symposium landing page to learn more. Show your support and get in touch with MMF. As a reminder, please join us next Thursday, November 19th at 1 p.m. for the third and final day of the Symposium. The theme for next week's conversation is System Change. How do we move forward together? Please note that immediately following today's event, you're invited to join speakers and fellow participants in the Zoom lobby room, where you can network as a follow-up questions and catch up with event participants, such as if you were in the room together at an MMF symposium. The link for the Zoom lobby is posted in the chat and on the screen. Feel free to take a few minutes to stretch and then join us in the Zoom lobby. Thank you all.